So in terms of whether a partial or a total knee replacement is the right option for you, really depends on your pattern of symptoms and your pattern of arthritis. I divide the knee up into three different compartments. You've got the inner compartment, the outer compartment, and the front. And actually, we can replace each of those compartments individually. If you have arthritis affecting just one of those compartments, then actually a partial knee replacement, replacing that compartment in isolation, might be the best option for you, depending on the pattern of arthritis and symptoms. More commonly, perhaps, people have arthritis that affects all compartments within the knee, and in those scenarios, then a total knee replacement, which involves replacing all three compartments in one operation with a single prosthesis, is the better option. When it comes to deciding between the two, really, as I said, it depends on the symptoms that you present with, the pattern of arthritis that is present on x-rays or further scans, and a tailored approach for yourself and your knee. So over the last few years, the use of robotic-assisted knee replacements has increased considerably in the UK and across the world. This is something that I do and I am able to offer. What is important to say that it's not the robot that's doing the work, and it's still the surgeon who is doing the knee replacement with the assistance of the robot. The way the robot works depends slightly on which robot is used, but it can be used to help plan the operation, to help plan the sizing of implants, and to try and optimize the position of those implants are inserted in order to gain the best possible outcome for you and your knee replacement. In addition to that, the use of robotics has also been shown to slightly reduce the amount of associated soft tissue injury, albeit small, during the operation that may help improve your recovery afterwards. So historically, I believe that partial knee replacements were seen as a stepping stone towards a total knee replacement. And actually, that's perhaps why they got a bad reputation many years ago. These days, however, with a personalised approach, deciding between a partial or a total knee replacement really depends on the symptoms that you present with and the pattern of arthritis that you have. Many people have arthritis affecting all aspects of the knee joints, and for them, a total knee replacement is the right answer. However, a smaller subset of patients have arthritis that just affects one compartment, whether that be the medial, the lateral, or the anterior compartment. And actually, a compartmental knee replacement is the better approach for them. It really depends on the x-ray findings and the symptoms that you present with in terms of what is the best option for yourself. And that can be discussed at your consultation. In terms of the recovery after your knee replacement, if we focus on total knee replacements first, we've come a long way over the last 30 to 40 years. It wasn't that long ago that patients were in bed for a week or two, allowing things to settle down. I'm a firm believer in either day case or 24-hour stay arthroplasty. And really what that references to is getting patients up and about immediately, allowing them to mobilise straight away and get going with their rehabilitation. Saying that, the importance of adequate pain control in those first few days and weeks is really important because it's not a painless operation, and that's something that's important to be aware of. I tell all my patients that the first 2 weeks really are quite tough, but actually being at home, lots of gentle mobilisation, small trips around the house or around the garden helps improve that recovery and get the muscles working again afterwards. Between weeks 2 and 6, people generally then make a significant improvement, and by 6 weeks, most people are either coming off their walking aids and thinking about perhaps getting back in the car and back to the hobbies that they enjoy. This continues to improve, and you see a significant improvement up to about the 3-month mark, and then overall, the knee replacement continues to improve up until about 12 to 18 months, and it's really only at that stage it tends to be as good as it's going to get. With a partial knee replacement, often the recovery is that little bit quicker. This is because it's a slightly shorter operation, and actually there's a slightly lower impact on the body and the knee joint as a whole. Saying that, it's the similar stepping stones in terms of recovery. Most people are driving somewhere between 6 weeks and 12 weeks, some a little bit earlier, some a little bit later, depending on how they're progressing. But I believe that's always quite a good reference of how people are doing afterwards. In terms of robotic knee replacements, then really the recovery is very much the same. Reports state that actually the pain people suffer in the immediate phase after the operation can be slightly reduced with the robotic knee replacement, but the overall recovery in general up to 12 to 18 months is very, very similar. So the aim of every knee replacement is to get you back doing the things that you want to enjoy. I tell all my patients, unfortunately, I can't give you the knee that you had when you were 20 because they are just not that good. But the minimum that I expect is to get a range of movement from 0 up to 90 degrees at least, and to try and get rid of 90 to 95% of your pain. I can't guarantee to get rid of all of it, but I really do hope to get rid of most of it. In terms of what you're able to get back to afterwards, well, essentially, there are very few restrictions. People say that you perhaps shouldn't run on a total knee replacement, but overall, hobbies such as cycling, generally going to the gym, golf, tennis, all these sorts of activities, there is absolutely no problem with doing that on a total knee replacement or a partial knee replacement further down the line. Famously, there's a professional skier that's had a partial knee replacement, and she went back to World Championship skiing this year, which shows that really any activities are possible.